Question: discuss the management of a patient with a suspected traumatic optic canal fracture. Answer: in a patient with suspected traumatic optic canal fracture, clinical evaluation and imaging studies such as CT scan are performed to assess the extent of injury and potential involvement of the optic nerve. Ophthalmologic consultation and potential surgical intervention are required to prevent vision loss. Question: explain the concept of pre-hospital triage tags in mass casualty incidents. Answer: pre-hospital triage tags are color-coded tags used to categorize and prioritize patients based on the severity of injuries and mass casualty incidents. Different colors indicate the level of medical attention required, helping allocate resources effectively and provide care to the most critical patients first. Question: describe the management approach for a patient with suspected traumatic sacral fracture. Answer: in a patient with suspected traumatic sacral fracture, imaging studies such as X-rays or CT scan are performed to assess the extent of injury. Non-operative management with immobilization or surgical intervention may be chosen based on the fracture type and stability. Question: discuss the management of a patient with a suspected traumatic upper airway injury. Answer: in a patient with suspected traumatic upper airway injury, clinical evaluation, imaging studies, and endoscopy are performed to assess the extent of injury and potential airway compromise. Supportive care, airway management, and surgical intervention may be required to maintain patency. Question: explain the concept of pre-hospital decontamination in trauma care. Answer: pre-hospital decontamination involves removing hazardous substances from a trauma patient's skin and clothing to prevent further exposure. It is essential in cases of chemical, biological, or radiological incidents to protect the patient and healthcare providers. Question: describe the management approach for a patient with suspected traumatic lateral malleolus fracture. Answer: in a patient with suspected traumatic lateral malleolus fracture, imaging studies such as X-rays or CT scan are performed to assess the extent of injury. Non-operative management with immobilization or surgical intervention may be chosen based on the fracture type and stability. Question: discuss the management of a patient with a suspected traumatic central cord syndrome. Answer: in a patient with suspected traumatic central cord syndrome, imaging studies, such as MRI, and clinical assessment are performed to evaluate spinal cord function and integrity. Supportive care, rehabilitation, and monitoring for neurological changes are important for recovery. Question: explain the concept of pre-hospital warming techniques in trauma care. Answer: pre-hospital warming techniques involve maintaining a trauma patient's body temperature to prevent hypothermia, which can worsen outcomes. Methods include warm blankets, heated fluids, and minimizing exposure to cold environments. Question: discuss the management of a patient with a suspected traumatic cervical spine injury. Answer: in a patient with suspected traumatic cervical spine injury, spinal immobilization and imaging studies, such as X-rays or CT scan, are performed to assess the extent of injury. Conservative management with immobilization or surgical intervention may be chosen based on the injury type and stability. Question: explain the concept of pre-hospital psychological support in trauma care. Answer: pre-hospital psychological support involves providing emotional reassurance and comfort to trauma patients and their families during the initial stages of care. It helps alleviate anxiety, fear, and stress associated with traumatic incidents. Question: describe the management approach for a patient with suspected traumatic olecranon fracture. Answer: in a patient with suspected traumatic olecranon fracture, imaging studies such as X-rays or CT scan are performed to assess the extent of injury. Non-operative management with immobilization or surgical intervention may be chosen based on the fracture type and stability. Question: discuss the management of a patient with a suspected traumatic spinal epidural abscess. Answer: in a patient with suspected traumatic spinal epidural abscess, imaging studies such as MRI and clinical assessment are performed to evaluate spinal cord function and the extent of infection. Urgent surgical intervention and antibiotic therapy are required to prevent neurological complications. Question: explain the concept of pre-hospital pharmacological pain management in trauma care. Answer: pre-hospital pharmacological pain management involves administering analgesic medications to trauma patients before reaching a hospital to alleviate pain and discomfort. It improves patient comfort, reduces stress response, and aids in assessment. Question: describe the management approach for a patient with suspected traumatic nasal bone fracture. Answer: in a patient with suspected traumatic nasal bone fracture, clinical evaluation and imaging studies such as X-rays or CT scan are performed to assess the extent of injury. Surgical intervention for realignment and stabilization may be considered for functional and cosmetic reasons. Question: discuss the management of a patient with a suspected traumatic spinal cord contusion. Answer: in a patient with suspected traumatic spinal cord contusion, imaging studies, such as MRI, and clinical assessment are performed to evaluate spinal cord function and integrity. Supportive care, rehabilitation, and monitoring for neurological changes are important for recovery. Question: explain the concept of pre-hospital cervical spine clearance in trauma care. Answer: pre-hospital cervical spine clearance involves assessing the cervical spine for stability and injury in trauma patients. Clearing the cervical spine involves ruling out injury before removing spinal immobilization devices, allowing for more comfortable and effective patient care. Question: describe the management approach for a patient with suspected traumatic medial malleolus fracture. Answer: in a patient with suspected traumatic medial malleolus fracture, imaging studies such as X-rays or CT scan are performed to assess the extent of injury. Non-operative management with immobilization or surgical intervention may be chosen based on the fracture type and stability. Question: discuss the management of a patient with a suspected traumatic retropharyngeal abscess. Answer: in a patient with suspected traumatic retropharyngeal abscess, clinical assessment, imaging studies, and endoscopy are performed to assess the extent of infection and potential airway compromise. Urgent surgical drainage and antibiotic therapy are crucial to prevent respiratory distress. Question: explain the concept of pre-hospital pediatric trauma care and its unique considerations. Answer: pre-hospital pediatric trauma care involves providing specialized care to injured children. It includes recognizing anatomical and physiological differences, using appropriate equipment, and addressing emotional needs to ensure optimal care during transport. Question: describe the management approach for a patient with suspected traumatic lateral epicondyle fracture. Answer: in a patient with suspected traumatic lateral epicondyle fracture, imaging studies such as X-rays or MRI are performed to assess the extent of injury. Non-operative management with immobilization or surgical intervention may be chosen based on the fracture type and stability. Question: discuss the management of a patient with a suspected traumatic tracheal injury. Answer: in a patient with suspected traumatic tracheal injury, clinical assessment, imaging studies, and endoscopy are performed to assess the extent of injury and potential airway compromise. Surgical exploration, repair, and appropriate airway management are crucial. Question: explain the concept of pre-hospital neuroprotective strategies in trauma care. Answer: pre-hospital neuroprotective strategies involve interventions to prevent or minimize secondary brain injury in trauma patients, including maintaining proper oxygenation, controlling intracranial pressure, and avoiding hypotension. Question: describe the management approach for a patient with suspected traumatic mandible fracture. Answer: in a patient with suspected traumatic mandible fracture, clinical evaluation and imaging studies such as X-rays or CT scan are performed to assess the extent of injury. Surgical intervention with fixation or wiring may be required for stabilization and optimal jaw function. Question: discuss the management of a patient with a suspected traumatic esophageal injury. Answer: in a patient with suspected traumatic esophageal injury, clinical assessment, imaging studies, and endoscopy are performed to assess the extent of injury and potential complications. Surgical exploration, repair, and appropriate airway management are crucial. Question: explain the concept of pre-hospital hypotensive resuscitation in trauma care. Answer: pre-hospital hypotensive resuscitation involves limiting aggressive fluid administration in trauma patients with hemorrhagic shock to maintain a lower blood pressure and minimize the risk of further bleeding. This strategy aims to prevent dilution of clotting factors and worsening hemorrhage. Question: describe the management approach for a patient with suspected traumatic patellar fracture. Answer: in a patient with suspected traumatic patellar fracture, imaging studies such as X-rays or CT scan are performed to assess the extent of injury. Non-operative management with immobilization or surgical intervention may be chosen based on the fracture type and stability. Question: discuss the management of a patient with a suspected traumatic diaphragmatic tear. Answer: in a patient with suspected traumatic diaphragmatic tear, imaging studies such as chest X-ray or CT scan are performed to assess diaphragmatic integrity and potential herniation. Surgical repair is required to prevent organ strangulation and respiratory compromise. Question: explain the concept of pre-hospital communication with social workers in trauma care. Answer: pre-hospital communication with social workers involves addressing patients' emotional, psychological, and social needs following traumatic events. Effective communication ensures appropriate support and resources are available during the patient's care and recovery. Question: describe the management approach for a patient with suspected traumatic acetabular fracture. Answer: in a patient with suspected traumatic acetabular fracture, imaging studies such as X-rays or CT scan are performed to assess the extent of injury. Non-operative management or surgical intervention, such as open reduction and internal fixation, may be necessary to restore joint stability. Question: discuss the management of a patient with a suspected traumatic bladder contusion. Answer: in a patient with suspected traumatic bladder contusion, clinical assessment, imaging studies, and cystoscopy may be performed to assess the extent of injury and potential complications. Supportive care and pain management are important aspects of management. Question: explain the concept of pre-hospital communication with chaplains in trauma care. Answer: pre-hospital communication with chaplains involves addressing patients' and families' spiritual and emotional needs following traumatic events. Effective communication ensures emotional support and appropriate resources are provided during times of crisis. Question: describe the management approach for a patient with suspected traumatic pelvic fracture. Answer: in a patient with suspected traumatic pelvic fracture, imaging studies such as X-rays or CT scan are performed to assess the extent of injury. Non-operative management or surgical intervention, such as pelvic fixation, may be necessary to stabilize the pelvic ring. Question: discuss the management of a patient with a suspected traumatic ureteral injury. Answer: in a patient with suspected traumatic ureteral injury, clinical assessment, imaging studies, and retrograde pyelography are performed to assess the extent of injury. Surgical repair or stent placement may be required to ensure proper urinary drainage. Question: explain the concept of pre-hospital communication with ethics committees in trauma care. Answer: pre-hospital communication with ethics committees involves addressing complex ethical issues that may arise during traumatic events, such as decision-making for patients without capacity. Effective communication ensures appropriate ethical guidance and decision-making. Question: describe the management approach for a patient with suspected traumatic hip fracture. Answer: in a patient with suspected traumatic hip fracture, imaging studies such as X-rays or CT scan are performed to assess the extent of injury. Non-operative management or surgical intervention, such as hip arthroplasty or internal fixation, may be necessary to restore joint stability. Question: discuss the management of a patient with a suspected traumatic urethral stricture. Answer: in a patient with suspected traumatic urethral stricture, clinical assessment, imaging studies, and retrograde urethroplasty are performed to assess the extent of injury. Endoscopic dilation or surgical reconstruction may be required to restore proper urinary function. Question: explain the concept of pre-hospital communication with patient advocates in trauma care. Answer: pre-hospital communication with patient advocates involving family members or designated representatives in decision-making for patients unable to communicate. Effective communication ensures patient preferences and values are considered during care. Question: describe the management approach for a patient with suspected traumatic hip dislocation and fracture. Answer: in a patient with suspected traumatic hip dislocation and fracture, clinical evaluation, imaging studies such as X-rays or CT scan, and prompt reduction are necessary to restore joint alignment and address associated fractures. Question: describe the principles of managing abdominal trauma in pediatric patients. Answer: principles of managing abdominal trauma in pediatric patients include: prioritize stabilization and assessment of ABCs. Obtain imaging studies, for example, ultrasound, CT scan, specific to pediatric patients. Surgical intervention for severe injuries, especially in cases of solid organ injuries, bowel injuries, or vascular injuries. Close monitoring, supportive care, and involvement of pediatric specialists. Address psychosocial aspects, pain management, and family support. Question: explain the management of a patient with a suspected abdominal trauma due to a fall. Answer: management of a patient with suspected abdominal trauma due to a fall involves: stabilize the patient's condition, perform a thorough primary and secondary survey to identify injuries, especially spinal injuries, obtain imaging studies, for example, CT scan, X-rays, to assess abdominal and skeletal injuries, surgical intervention, if needed, based on the type and severity of injuries, multidisciplinary care, pain management, and rehabilitation if indicated. Question: discuss the management of a patient with a suspected abdominal trauma in a geriatric patient. Answer: management of abdominal trauma in a geriatric patient involves. Prioritize stabilization and assessment of ABCs. Consider underlying medical conditions and frailty of the patient. Obtain imaging studies, for example, CT scan, X-rays, to assess injuries and anatomical changes. Surgical intervention, if needed, while considering the patient's overall health status. Multidisciplinary approach, geriatric assessment, and specialized care for older adults. Postoperative care, complications prevention, and rehabilitation. Question: explain the concept of primary blast injury and abdominal trauma assessment. Answer: primary blast injury refers to injuries caused directly by the blast wave itself. In abdominal trauma assessment, it can lead to injuries such as hollow viscous injuries due to pressure changes, blast lung injury, and organ damage caused by the rapid compression and decompression of tissues. Question: describe the management approach for a patient with a suspected abdominal trauma from an explosion. Answer: management of abdominal trauma from an explosion involves. Stabilize the patient's condition. Perform a thorough primary and secondary survey to identify injuries, including blast injuries and trauma to other body regions. Obtain imaging studies, for example, CT scan, X-rays, to assess injuries to the abdomen and other areas. Surgical intervention for significant injuries, especially blast-related injuries, vascular injuries, or hollow viscous injuries. Multidisciplinary care, addressing blast-related complications, and psychological support. Postoperative care, rehabilitation, and long-term follow-up. Question: discuss the role of trauma scoring systems. For example, ISS, GCS, in abdominal trauma assessment. Answer: trauma scoring systems play a critical role in assessing the severity of abdominal trauma and overall patient status. The Injury Severity Score, ISS, assesses the severity of injuries based on anatomic regions, aiding in triage and treatment planning. The Glasgow Coma Scale, GCS, evaluates neurological status, helping to predict outcomes and guide management strategies. Question: explain the management of a patient with a suspected abdominal trauma in a combat setting. Answer: management of abdominal trauma in a combat setting involves. Prioritize stabilization and assessment of life-threatening injuries. Rapid assessment and interventions in a resource-limited environment. Utilize field-based imaging modalities, such as portable X-rays or ultrasound, for initial assessment. Surgical interventions for severe injuries, addressing hemorrhage and contamination. Multidisciplinary combat casualty care, damage control strategies, and evacuation planning. Postoperative care and strategies to manage ongoing threats in the field. Question: describe the principles of damage control surgery in abdominal trauma. Answer: damage control surgery involves a staged approach to managing severely injured patients with abdominal trauma. Principles include rapid control of bleeding, prevention of contamination, temporary closure of the abdomen, and resuscitation. This approach focuses on stabilizing the patient's condition before definitive surgical repairs are performed. Question: discuss the management of a patient with a suspected abdominal trauma and concomitant spinal injury. Answer: management of a patient with abdominal trauma and concomitant spinal injury involves. Prioritize stabilization and assessment of ABCs. Coordinate with spine specialists to manage spinal injuries while addressing abdominal trauma. Obtain imaging studies, for example, CT scan, X-rays, to assess injuries to both regions. Surgical intervention for significant injuries, considering the impact on both the spine and abdomen. Multidisciplinary approach, neurosurgical consultation, and rehabilitation planning. Close monitoring, infection prevention, and complications management. Question: explain the management of a patient with a suspected abdominal trauma and concomitant pelvic fracture. Answer: management of a patient with abdominal trauma and concomitant pelvic fracture involves. Prioritize stabilization and assessment of ABCs. Coordinate with orthopedic specialists to manage pelvic fractures while addressing abdominal trauma. Obtain imaging studies, for example, CT scan, X-rays, to assess injuries to both regions. Surgical intervention for significant injuries, considering the impact on the abdomen and pelvis. Multidisciplinary approach, addressing hemorrhage control, vascular injuries, and pelvic stabilization. Close monitoring, complications prevention, and multidisciplinary rehabilitation. Question: explain the purpose of using an esophageal balloon in trauma patients. Answer: An esophageal balloon is used to monitor intra-abdominal pressure in trauma patients. Elevated intra-abdominal pressure can lead to abdominal compartment syndrome, causing organ dysfunction. Continuous monitoring helps detect early signs and guide interventions. Question: discuss the indications and complications of using a percutaneous tracheostomy in trauma patients. Answer: percutaneous tracheostomy is indicated in trauma patients requiring prolonged mechanical ventilation. Complications may include bleeding, infection, tracheal stenosis, and injury to adjacent structures. Proper technique and sterile precautions are crucial to prevent complications. Question: what is the significance of Bextriad in cardiac tamponade assessment? Answer: Bextriad consists of hypotension, distant heart sounds, and elevated jugular venous pressure. It is indicative of cardiac tamponade, a life-threatening condition characterized by pericardial fluid accumulation. Timely intervention, such as pericardiocentesis, is necessary to relieve pressure on the heart. Question: describe the management of a patient with a suspected traumatic pancreatitis. Answer: in a patient with suspected traumatic pancreatitis, close monitoring of clinical symptoms, amylase levels, and imaging studies is essential. Supportive care, pain management, and avoiding oral intake are important to allow the pancreas to heal and prevent complications. Question: explain the role of tranexamic acid, DXA, in trauma patients. Answer: tranexamic acid, DXA, is used in trauma patients to prevent or reduce excessive bleeding. It works by inhibiting fibrinolysis, promoting clot stability, and reducing the risk of hemorrhage. DXA is particularly valuable in controlling bleeding in patients with traumatic injuries. Question: discuss the management of a patient with a suspected traumatic spinal cord injury without neurological deficit. Answer: in a patient with a suspected traumatic spinal cord injury without neurological deficit, spinal immobilization is maintained until appropriate imaging studies are performed. Close observation, serial neurological assessments, and early mobilization are important to prevent complications. Question: what is the significance of battle sign in head trauma assessment? Answer: battle sign refers to bruising behind the ear, often indicative of basilar skull fracture or head trauma. Its presence alerts healthcare providers to potential skull and brain injuries, prompting further evaluation and monitoring. Question: describe the management approach for a patient with suspected traumatic chylothorax. Answer: in a patient with suspected traumatic chylothorax, lymphatic fluid accumulation in the pleural space, management includes chest tube placement, low-fat diet, and supplementation with medium-chain triglycerides. Surgical intervention may be necessary if conservative measures are ineffective. Question: explain the purpose of using a retrograde urethrogram in trauma patients. Answer: a retrograde urethrogram is used to assess for urethral injuries in trauma patients with pelvic fractures or pelvic trauma. It involves injecting contrast dye into the urethra and taking X-rays to visualize any disruptions or strictures. Question: discuss the indications and technique for using an inferior vena cava (IVC) filter in trauma patients. Answer: an IVC filter is used in trauma patients with high risk of deep vein thrombosis, DVT, or pulmonary embolism, PE. It is inserted into the inferior vena cava to trap blood clots before they reach the lungs. Proper patient selection and technique are important to prevent complications. Question: what is the role of damage control neurosurgery in trauma patients? Answer: damage control neurosurgery involves limited surgical interventions to control bleeding, remove hematomas, or reduce intracranial pressure in critically ill trauma patients. Definitive repair is delayed until the patient's condition stabilizes. This approach aims to prevent secondary brain injury and optimize outcomes. Question: describe the management of a patient with suspected traumatic aortic rupture. Answer: in a patient with suspected traumatic aortic rupture, immediate hemodynamic stabilization is crucial. Imaging studies, such as CT angiography, are performed to confirm the diagnosis. Definitive surgical repair or endovascular stent grafting is required to prevent further complications. Question: explain the role of damage control vascular surgery in trauma patients. Answer: damage control vascular surgery involves temporary vascular repair to control hemorrhage and restore perfusion in critically ill trauma patients. Definitive repair is delayed until the patient's condition stabilizes. This approach minimizes blood loss and optimizes patient outcomes. Question: discuss the management of a patient with a suspected traumatic bronchial injury. Answer: in a patient with suspected traumatic bronchial injury, bronchoscopy is performed to assess the airway and identify any injuries. Surgical repair or stenting may be necessary for severe injuries that compromise airway integrity. Question: what is the significance of subcutaneous emphysema in trauma patients? Answer: subcutaneous emphysema refers to the presence of air beneath the skin, often caused by air leakage from the respiratory or gastrointestinal tract. It can indicate underlying injuries, such as pneumothorax or pneumomediastinum. Identification of subcutaneous emphysema prompts further evaluation and appropriate management. Question: describe the management approach for a patient with a suspected traumatic cardiac injury. Answer: in a patient with a suspected traumatic cardiac injury, immediate hemodynamic stabilization is crucial. Echocardiography and other imaging studies help assess cardiac function and identify injuries. Surgical exploration may be necessary to repair cardiac injuries and control bleeding. Question: explain the concept of secondary brain injury in trauma patients. Answer: secondary brain injury refers to the neurological damage that occurs following the initial traumatic insult. It results from cascading processes such as ischemia, edema, inflammation, and increased intracranial pressure. Preventing and managing secondary brain injury is crucial to improve patient outcomes. Question: discuss the management of a patient with suspected traumatic laryngeal injury. Answer: in a patient with suspected traumatic laryngeal injury, flexible laryngoscopy is performed to assess the airway and identify any injuries. Surgical repair may be required for severe injuries that compromise airway patency. Question: describe the approach to managing a patient with a suspected traumatic bladder injury. Answer: in a patient with a suspected traumatic bladder injury, a cystogram is performed to assess the bladder for leaks. If a leak is identified, surgical repair is usually required to prevent urinary leakage and infection. Question: explain the role of intracranial pressure, ICP, monitoring in traumatic brain injury. Answer: intracranial pressure, ICP, monitoring is used in traumatic brain injury to assess and manage elevated pressure within the skull. It helps guide interventions to control ICP, maintain cerebral perfusion, and prevent secondary brain injury. Question: discuss the indications and technique for using a thoracostomy tube in trauma patients. Answer: a thoracostomy tube, chest tube, is used in trauma patients with pneumothorax, hemothorax, or pleural effusion to drain air or fluid from the pleural space. The tube is inserted through the chest wall and connected to a drainage system to restore lung expansion. Question: what is the purpose of using an airway exchange catheter in trauma patients? Answer: an airway exchange catheter is used to facilitate the exchange of an endotracheal tube in trauma patients with difficult airways. It provides a temporary conduit for ventilation while the original tube is removed and replaced with a new one. Question: describe the management of a patient with suspected traumatic abdominal compartment syndrome. Answer: in a patient with suspected traumatic abdominal compartment syndrome, immediate surgical decompression is crucial to relieve pressure within the abdominal cavity. This prevents organ dysfunction and restores normal perfusion. Question: explain the role of magnetic resonance imaging, MRI, in trauma patients. Answer: magnetic resonance imaging, MRI, is used in trauma patients to assess soft tissue injuries, spinal cord injuries, and brain injuries. It provides detailed anatomical and structural information, aiding in accurate diagnosis and treatment planning. Question: discuss the management of a patient with suspected traumatic esophageal injury. Answer: in a patient with suspected traumatic esophageal injury, flexible endoscopy or contrast studies may be performed to assess the esophagus. Surgical repair is required for severe injuries to prevent complications like mediastinitis or sepsis. Question: what is the significance of vascular blowout in trauma patients? Answer: vascular blowout refers to the sudden rupture of a blood vessel, leading to severe hemorrhage. It can occur in trauma patients with vascular injuries or during surgical procedures. Immediate control of bleeding, hemodynamic stabilization, and surgical intervention are crucial to prevent exsanguination. Question: describe the management approach for a patient with suspected traumatic femoral artery injury. Answer: in a patient with suspected traumatic femoral artery injury, immediate hemodynamic stabilization is vital. Surgical exploration and repair are required to control bleeding and restore vascular integrity. Temporary shunting may be used to maintain perfusion during surgery. Question: explain the concept of permissive hypotension in trauma resuscitation. Answer: permissive hypotension involves intentionally maintaining lower blood pressure levels in trauma patients to prevent exacerbating bleeding. It aims to avoid over-resuscitation, minimize blood loss, and improve outcomes, particularly in cases of penetrating trauma. Question: discuss the indications and complications of using a central venous catheter, CVC, in trauma patients. Answer: a central venous catheter, CVC, is indicated in trauma patients for central venous access, administration of fluids, medications, and monitoring of central venous pressure. Complications may include infection, thrombosis, and pneumothorax during insertion. Question: what is the role of hypertonic saline in traumatic spinal cord injury management? Answer: hypertonic saline is used in traumatic spinal cord injury management to reduce spinal cord edema and improve perfusion. Its osmotic effect helps draw excess fluid out of spinal tissues, reducing inflammation and minimizing secondary damage. Question: describe the management of a patient with suspected traumatic peripheral nerve injury. Answer: in a patient with suspected traumatic peripheral nerve injury, careful neurological assessment and imaging studies are performed to identify the location and extent of injury. Supportive care, pain management, and physical therapy are important for recovery. Question: explain the role of damage control orthopedics in trauma patients. Answer: damage control orthopedics involves temporary stabilization of fractures and joint injuries in critically ill trauma patients. Definitive repair is delayed until the patient's condition stabilizes. This approach helps prevent complications and optimize patient outcomes. Question: discuss the management of a patient with a suspected traumatic corneal injury. Answer: in a patient with a suspected traumatic corneal injury, eye protection and topical antibiotics are essential to prevent infection and promote healing. Ophthalmologic consultation may be required for further evaluation and treatment. Question: what is the purpose of using an intra-aortic balloon pump, IABP, in trauma patients? Answer: an intra-aortic balloon pump, IABP, is used in trauma patients with severe cardiac dysfunction to provide temporary circulatory support. It improves coronary perfusion and reduces myocardial oxygen demand by augmenting diastolic pressure and decreasing afterload. Question: describe the management approach for a patient with a suspected traumatic subarachnoid hemorrhage. Answer: in a patient with a suspected traumatic subarachnoid hemorrhage, close neurological monitoring and imaging studies, such as CT scan, are essential to confirm the diagnosis and assess the extent of bleeding. Supportive care and prevention of complications are important aspects of management. Question: explain the concept of triage in trauma care. Answer: triage involves categorizing trauma patients based on the severity of their injuries and the urgency of care needed. It helps allocate resources appropriately and ensures that the most critically injured patients receive timely interventions. Question: discuss the indications and complications of using an indwelling urinary catheter in trauma patients. Answer: an indwelling urinary catheter is indicated in trauma patients with urinary retention or the need for accurate urine output measurement. Complications may include urinary tract infection, urethral injury, and catheter-associated urinary tract infection, CAUTI. Question: what is the role of recombinant activated factor 7, RFIA, in trauma patients? Answer: recombinant activated factor 7, RFIA, is used in trauma patients with severe bleeding and coagulopathy to promote clot formation. It is particularly valuable in patients refractory to conventional hemostatic interventions.